Hey guys, welcome back to the Phone Frat podcast. We have Dr. Banerjee on again with a Spanish stroke scale. And they wanted to try to do something similar to the BEFAST. We know that there's lots of areas with the Spanish-speaking populations that maybe the BEFAST doesn't really translate. And so this was meant to be both used at home to know if you should call 911, but also they got these little laminated sheets that they can use for their providers, even if they don't speak Spanish, that translate it. And I'm not going to go too far into it, but it's kind of a cool concept.
Yeah, when I think about stroke scales, it's a very much a give and take where you have to give some instructions and then you're taking the patient's feedback, whether it's verbally or if it's in the exam that you're doing, you're kind of taking the visual feedback as well. And if you think back to the NIH stroke scale, like one of the first questions on there is, does the patient follow commands? And it's can they squeeze your hands? Can they blink their eyes? And that if the patient can't do either one of those things, then you're in for a really long exam. And that could be either neurological damage or it could be from just a language barrier as well. So it's tough if you don't have the tools. So I thought this was a really great tool and it's pretty simple. I appreciate the process that they went through to get it done. Did you see the Open AI demo? Not to bring this back around to AI again, but I don't know if it can happen. I know they had a 4.0 demo, and I can't remember her name. She's one of the Open AI people, and she speaks Italian. They were doing this demo on stage, and the prompt that they gave 4.0, the voice model, I think that's the most updated voice model. The guy was like, okay, I'm sitting here with my friend and they only speak Italian and I only speak English. So when you hear Italian, you can just substitute that for Spanish. When you hear Spanish, translate it to English. And when you hear English, translate it to Spanish. And I thought that was a really cool concept. I think we're really on the verge of like these universal translators. And I think that could be useful, like even if you're not too confident in reading the text, like you should. I was thinking when he was reading through the text, which you guys will see in the interview, like I'd want to practice that with a Spanish speaker a few times, have somebody grade how I'm actually pronouncing those words for sure. So if you can get something that's kind of reliable, or even if like you had a recording of you saying those words that you could just play if you got them right, kind of practiced them and then played them. I thought that would be a pretty cool thing. Or if you had an app, kind of read that stuff out like a Google Translate or something. But I do think, getting nerdy again for a second, I was listening to Colby Colbett's keynote he recently gave on AI and critical care, just EMS in general. And him and I are both of the belief that one day you'll be wearing these glasses that kind of do real-time translation. I think they're already kind of out there where they put captions on people, but I don't know if they can speak it back to the person yet, but that'll probably be coming at some point. But the Google Translate stuff is really useful.
Yeah, and there's certain things that you could see, right? Like, facial droop, or maybe they squeeze your hands and one side's weaker than the other. But there's other like subtle things that you really need to know how to interpret it. And like, who knows? Does ChatGPT know that they're slurring their speech, and that's not how you actually say that word, or does it translate? What does dizziness sound like somewhere else? Like, how are they going to verbalize that? So I could definitely see why it would help to have like a family member there to help you. But I do like this little laminated sheet. I think it's going to help a lot of people. It'd be interesting to see the data. I think it's probably too soon for now to see like long-term data from it. But we will put just a copy of that in the show notes of this podcast as well. So how did you guys come across this? What's the story behind this?
So, was not my idea. There was a lady called Marcia Wilson. She lives in Austin, Texas, who basically was trying to get some form of community engagement. And they were looking at different ways to educate the Spanish-speaking stroke patients. And there were so many people that were missed. And they kind of came up with, how do we do this? And there was initially a thing called Rapido, which they used, and didn't like it because it was so long. One of the systems did use it, but obviously my Spanish was pretty terrible at the time, and now it's just less than terrible, which is good. And so we engaged with another person called Renly Crow. She's a PhD, works for ESO, who lived in Mexico for a while, and I said, well, maybe you could partner up what I'm trying to convey in a stroke form that you can use. So we tried multiple different
Acronyms and stuff.
mnemonics,
Yeah.
acronyms and mnemonics that would try fit, and we didn't. And then finally, she came up with, how about AHORA? And we can use all the things we need to create a Spanish stroke screen that would work, and we could help educate and be simple and similar to BEFAST, and that we can use for the Spanish population. And it kind of like we spent months massaging the mnemonics to fit, and it kind of worked out, and it's taken off and become a very successful in a lot of places been used.
So just so I understand, to clarify, this is for a Spanish speaking person to use to assess another Spanish speaking person. Or is this for like for me, let's say I encounter somebody in the field that speaks Spanish, could I still use my Be Fast? Is it still the same? How would you frame like who this is ideal for?
So we've used it for EMS, and what we've done, we've laminated it, and we have it in the front and back to explain what each wording was. A lot of times, like our community is 30% Hispanic, so there are people who we are not going to be able to accurately convey what symptoms are you having, and even in your poor English Spanish translation, people can look at the words and go, "Are you experiencing any of these?" And they can, with family, hopefully can recognize, "Hey, they're having these symptoms. So yes, so this person meets uh, stroke alert criteria, so we can transport them." Whereas telling someone Spanish, "Hey, do you feel like you're dizzy?" doesn't really correlate with anything for them. Do you feel like your arm's weak, your leg's weak? They're not going to know. I don't know what you're telling me. So we're not going to accurately assess stroke patients who are Spanish speaking only. With this tool, we have it on both sides, so our crews can read what the Spanish definition is, even if it's semi-garbled. They will still know, oh, okay, I know what hablar is. Okay, that's speech. So yes, I am having trouble speaking, or their family say, yes, her or his speech has changed in the last 2 hours. So
Mm,
that enough would be enough to communicate with our crews they're having stroke symptoms that need immediate attention.
awesome, man. Let's get into it.
All right. So basically, no intent to stroke. So we've created this stroke screening tool for Spanish-speaking patients. We've used it in our EMS system. A lot of our local hospitals have, including Daycare, Lakeland Health, are all using it as well. So, and Orlando Health is as well, which is kind of nice. So it's kind of grown a lot more than we thought it would initially. And a lot of EMS agencies have taken it over as well. The funny thing about stroke, it happens to everybody, and regardless of age, health, if you have genetic predisposition, it's going to happen to you. And if you look at the stroke numbers worldwide, there's 101 million people who are living with stroke symptoms, post-stroke uh, deficiencies, disabilities, and 1 in 4 people over the age of 25 will have some form of stroke in their lifetime. That's kind of amazing. 25% of people over 25 will have a stroke. And 90% will basically, all strokes are linked to identifiable risk factors. So it's a lot of people. It's going to happen to someone we know. I'm sure you know somebody who's had a stroke. Um, we do a fairly good job here, not a great job, um, but we do a really bad job when it comes to the Spanish speaking community. So we thought maybe we'll do something different. When we look at the stroke facts in general, and every picture that has somebody on there has had a stroke. Now everybody knows this Emily Clark or Amelia Clark. She was in, and I didn't see the series at all, Game of Thrones. She had a hemorrhagic stroke, and she was 28 years old. But there's 800,000 people a year who have a stroke, $56 billion a year it costs, $721 billion cost worldwide. And every year in the United States, we have 30,000 permanent nursing home patients a year, which means the cost isn't just the cost of the treat the stroke, it's the disabilities at home, having home healthcare nursing, having to change their life. So it's very devastating and very expensive. And there's basically two major types of stroke. There's ischemic stroke, and that's the thing that we use TNK or TPA for. The main thing is the middle cerebral artery stroke, which is where you do the thrombectomies, or that's the main issues that cause the most disabilities that we have. Severe long-term disabilities. These people are also, if you have a middle cerebral artery stroke, you're resistant to TPA and TNK, so you need to go in and basically pull out the clot as well. 15% of our strokes are about hemorrhagic strokes, and of which 8% are subarachnoid hemorrhages. Interesting thing with this, it's much higher in the Spanish-speaking population than the other populations that we take care of. And if you look at signs and symptoms of ischemic versus hemorrhagic stroke, how can you kind of look in what they have? Basically, acute ischemic strokes, they have high blood pressures normally, rare loss of consciousness, rare headaches, rare nausea, vomiting, and they can also wake up with these symptoms. With hemorrhagic stroke, it's very different. Usually they have a bad headache. They have some form of loss of consciousness, usually during activity. 40% of the time they'll have a really bad headache. 50% will have vomiting syndromes or vomiting type symptoms, and 15% wake up with these kind of stroke symptoms. So they do vary, and if you can kind of identify how they present, it can kind of take you down the pathway that you need.
And Dr. Banerjee, you mentioned Hispanic population has a higher risk, or they're a higher risk factor for hemorrhagic stroke. Is that because, whenever you hear that, you're always like, oh, there must be something biologically different about them? Or is that more so access to healthcare, social determinant, stuff like that?
I don't know. It could be just genetic. Every ethnicity has unique features about their physiology and their anatomy. Um, I think even if you look at overall, just trending the amount of hemorrhagic strokes between different types of ethnicities, uh, Spanish people have higher, and maybe it's because they have more uncontrolled blood pressure or poor
Yeah,
access to healthcare. Um, it could be many, many things, but prime, most probably it's something like that.
gotcha.
So what we're doing with strokes is the main area we're looking at is the core of the stroke, which is the area that dies first. And that's the core is defined as something that has less than 25% blood flow to that specific area. And the ischemic penumbra is the area we're trying to save. And that's where we're doing the TNK, TPA, thrombectomies. We're trying to improve circulation because that is actually viable brain that we can save. Now, basically, every second, 32,000 brain cells die, and that's 1.9 million brain cells every minute. And that's about 7 miles of nerve fibers are lost every minute, which is
Wow.
basically 420 miles of myelinated brain fibers lost every hour. So just think how much neurologic deficit we're getting every minute, every hour that we're delaying therapy. It's staggering how much we lose. If we break it down into neuronal loss, synapses lost, and synapses are basically where the nerves kind of talk to each other, right? And how much it ages you based on your stroke. So if you have a stroke, basically every hour you lose 120 million neurons, 830 billion synapses, and you age 3.6 years. Per second, and per minute, per hour, per stroke, this is the average aging that we do. So for every second we don't treat a stroke, you age by 8.7 hours. Every minute, 3.1 weeks. Every hour, 3.6 years. And all strokes in general, 36 years you age, accelerated aging. So these are devastating to people. And so it's so important that we recognize these strokes and get these people to the right places as soon as possible. So in our population in the United States, we've had a significant increase in the Hispanic population. And if you look by races, Asians, Blacks, and Hispanics have the largest growth between 1990 and 2023 by 19%. And if you look at the populations in general, the highest Spanish populations are obviously in California, Texas, and Florida. And obviously, you see whatever state you're in, you can see the Hispanic population by state on this map. The stroke in Hispanic population is the #1 cause of disability. It's the third leading cause of death, which is different than our society in the American society in general, because it's the fifth leading cause of death in the general population currently. More ischemic and intracranial hemorrhagic strokes than the normal population, and the Hispanic cost is $313 billion annually in this country. Why is Spanish speaking so important? It's the #1 language spoken by 12.5% of the population, significantly higher rate of hemorrhagic strokes. They have strokes at much higher, at younger ages. And they did a survey that less than 20% of Spanish-speaking stroke survivors could actually identify 3 stroke symptoms accurately. So that's quite staggering. So they wouldn't even know to call 911 or tell a family that you're having a stroke. And as you've seen how bad the consequences are. Also, limited English proficiency, lack of educational materials. They have twice as likely to have low health literacy and 3 times as likely to misunderstand medical instructions, which usually we, print our medical discharge summary in English, and if they don't speak English or can read English, it doesn't really help their follow-up or their education. So why do they have so many strokes or significant stroke problems in the Hispanic community? Poor control of medical conditions, lower socioeconomic status, limited access to quality health care. The interesting thing, though, is that in the white population, they have a higher stroke mortality, especially at older ages. And it's probably because the Hispanic community do kind of band together as a community more than the white population in general, and that you become more isolated and go to nursing home rehab facilities where maybe you do better when your family's taking care of you. Maybe they're not as medically trained, but they have the compassion and love for you that maybe that helps you get better quicker.
That makes sense. I could totally see that.
So you look at the problems of stroke recognition. There is no simple mnemonic that is universally used currently. And the KISS principle works for basically everything. And so we kind of looked about what can we do to make this better? We know that there's significant barriers to access of healthcare, language, health literacy. When we created a stroke screening sign or an acronym, we wanted to make sure that we want to remove any possible barriers to help save these lives. And then the treatment obviously depends on early recognition, EMS activation, because even all the studies have shown that EMS stroke patients get treated quicker and faster than they do if you just walk in. So we were trying to push them to call EMS so we could activate their stroke care earlier than you would if you just went to the hospital and sat there. Now, if you look at stroke in general, it's kind of transitioned from FAST to BEFAST. FAST was a great initial screening. BEFAST added balance and eye movement or eye deficiencies to the stroke algorithm, which added posterior stroke symptoms and signs that were missed by BEFAST. So we wanted to kind of make sure it was kind of all inclusive. And as I said, BEFAST include balance, gait, and eyes. And basically what it would do is included all the face, arm, and speech and time, but it also added the cortical signs that would also be significant, especially for posterior circulation strokes as well. Now, all EMS systems have stroke alert systems, I'm sure, and the goal is to minimize time to treatment, maximize patient recovery, and most importantly, take the right patient to the right center. There's no point taking everyone to a primary stroke center when they can't do anything when it's 4 hours into it. And we've created a stroke screening tool that will basically help triage people to the appropriate center, make sure they go to comprehensive, thrombectomy, primary based on signs, symptoms, and time. Also, are they on anticoagulants? All these things matter because you can't use certain therapies at certain places based on what you are, where you had the stroke, what time the stroke was, and what medications you take. So the initial stroke screening for the Spanish population was they thought BEFAST to acute rapido. And both of them are helpful, but there are a lot of words for this. And if you look to the acute rapido for the functionality of it, it really doesn't have a easy mnemonic that goes with the words for rapido. Both BEFAST and FAST are easy to remember. So you know face, arm, speech, time, and the public can remember that and say, hey, I'm having a stroke, but I remember BEFAST or FAST. However, this really can't be done with the Spanish-speaking population with what they have currently. So, and the other thing, as we wanted to stress, was there is a significant increase of intracranial hemorrhage versus the white population, the Spanish population, and that's not really included in FAST, BEFAST, or Rapido. So we wanted to make sure we were covering that as well. So we talked about how this kind of developed, and Marcella Wilson is the person who kind of brought the idea to me. I kind of stumbled over it a little bit. We got Remley involved, and we kind of collaborated to come up with the AHORA, which was basically Remley's idea. And we kind of massaged the mnemonics to fit the symptoms that they had. Now, both of them are great Spanish speakers, and then you have me. So I was able to fumble through this and uh, try not to embarrass myself too much and learn this process. And I think we've made hopefully an improvement in people's lives by having it. We selected BEFAST as the transition to Spanish because of the most well-known scale. Obviously, BEFAST is easy to remember with each letter standing for a symptom. And the symptoms of the ischemic stroke, which is 85% of the strokes that we talked about, uh, we wanted to focus on the middle cerebral artery strokes, and that included having posterior strokes as well with balance vision added as well. AHORA, which we developed, had 5 letters. BEFAST was 6, and Rapido was 6. So we thought the less words, the easier to remember.
Yeah.
We wanted to have headache as part of it because that's part of the subarachnoid hemorrhage screening tool. And obviously wanted to make sure these populations are addressed. And as we said, every letter corresponded to something, and that was something we wanted to make sure that happened. To briefly summarize, we started with Rapido. We couldn't make it work. We wanted to have BEFAST. We developed AHORA, which kind of resembled BEFAST, had all the things BEFAST had, but also added headaches as well. And AHORA in Spanish means now, which
Oh, interesting.
hopefully gives a sense of urgency for the
Yeah.
Spanish population to say, hey, now I need you to react.
Hmm.
So why is headache added? Because of the subarachnoid hemorrhage component. It was important difference that it makes to recognize these kind of tools for the Spanish-speaking population. And we wanted to have like the worst headache of your life, which is kind of pathognomonic for a subarachnoid hemorrhage. And also that was included in the AHORA as well. And if you're not sure about the subarachnoid hemorrhage signs and symptoms, you've got nausea, vomiting, sensitivity to light, blurred vision, stiff neck, and sudden and severe headache. And obviously, this is a subarachnoid hemorrhage, but these are the signs and symptoms that are classically associated with that type of stroke. So this is Polk County. We rolled this out in 2021. We're the fastest growing county in the United States. Our population is about 850,000. 30% of our population is Hispanic. We ran 102,000 EMS transports last year and had 125,000 calls and have about 900 people who work with me for the EMS component for fire rescue. So this is AHORA, incorporated in our protocols in 2021. We developed electronic patient care report through Fireworks, which we integrated in our EMS run report as well. So our crews can actually pull this up, ask the questions, and have the patient agree to what symptoms they have and document it accordingly.
What is Fireworks? Is that like Pulsera or what is the?
So Fireworks is kind of like a electronic patient care report system that we have. There's Image Trend, ESO, name
Gotcha. Okay.
whatever you have. Fireworks is what we used, and we used it because we were able to actually, because apparently I'm high maintenance, so I really want these specific tools in there that they were able to customize and put in how I wanted it so that our crews were able to not have to run back to the truck to recognize something. It's actually in the report they can put in and recognize it and then go through the algorithm for the patients.
Gotcha. That makes sense.
So basically, the whole thing is como reconocer un ataque cerebral ahora, which means recognize a stroke in the brain now. And obviously, I apologize to any Spanish-speaking patients or people listening. So I'm doing the best I can, and I know you'll do it 100 times better than I will. But this is how to recognize a stroke now is what we based it on. And that's the first part of that whole thing. That's the top of the presentation here. So andar, which means are you having trouble walking or do you have balance issues? And that basically in Spanish, you would ask them is, ¿tiene dificultad para caminar? Or ¿tiene problemas con el equilibrio? So basically having trouble with balance and walking. The second one, and that's andar, hablar, which is ¿tiene difficulty para hablar? Entender, which means are you having trouble with talking or having trouble understanding what I'm saying? And that's hablar. Ojos, which is basically eyes. Do you have any vision changes, any double vision? difficulty seeing in either eye, and that's tinea again cambio de vista, vision double, or dificultad para ver con ambos ojos. And again, my apologies, but that's basically, do you have any vision changes, double vision, blurred vision, in general? Rostro means face, is half of your face drooping. Do you have a sudden and intense headache unlike you've ever felt before? So basically, tiene la mitad del rostro ciado, tiene un frecuente dolor de cabeza, which is headache. Repriento como llamas loja sadiendo, and that's is it unlike you've ever had before, and that's rostro. And what we're trying to do is emphasize signs of the intracranial hemorrhage or subarachnoid stroke, and that's rostro. Ambos brazos o piernas basically is both arms and legs. Do you have difficulty or are you unable to lift one arm or one leg on the same side of the body? Not both sides, just specifically one side of the body. So tiene debilidad o dificultad para levantar un brazo o una pierna en al misero lado del cuerpo. And again, my apologies. But that basically is covering weakness or weak side of one universal side of one side of the body for weakness of arms and legs. And the last part is if you have yes to any of these questions, call 911 now, even if your symptoms have disappeared. And that's Lamana 911 AHORA. So basically what we're trying to do is if you have any of these symptoms, we're already there, we can transport you to the hospital to make sure you're not having a stroke.
And do you show
It's,
them like a card with this on it, or how is this done in the EMS space
so
if they
we've a
don't speak
laminated,
Spanish?
so we've a laminated card. And what the laminated card does, it's one on this side. So we've AHORA on one side in Spanish. And then for our crews, we have it, as you see on this other one, on the right-hand side, on the opposite side of the
Oh, nice. Okay,
laminated card.
perfect.
So our crews can, who are basically as competent at speaking Spanish as I am, can go, oh, okay, so that's what that is. So you look at Andar, trouble walking, hablar, trouble with speech, hoyos, trouble with seeing, rostro, trouble with facial droop or headaches, and ambros brazos, any weakness on one side of your head, one side of your leg, or one side of your arms. And if you have any of these symptoms, call 911. So that's basically on a laminated card. We have it in our ambulance. They can take it out and they can point to each one. Usually there's a family member there. If not, at least they can read and they can point and say, yes, I have any of these symptoms. And so that's easier for our crews to go and speak to these patients that maybe don't communicate as well as English speaking patients do.
And I would imagine you probably have quite a few Spanish speaking providers on the service with the population being that high in Florida.
Yeah, we do. And thankfully they are helpful. And, you probably have at least 50% of our crew speak Spanish, maybe higher, which helps a lot. So
Hmm.
if you're a lost person like me, you have someone who can go, hey, dude, this is what it is. And, we can actually communicate better with with the patients than we would if I was just kind of doing it. And actually in the ER, I've actually done this and I've taken the card with me to Spanish speaking patients only. And I go, do you have any of these symptoms? They'll point, yes, I'm dizzy and I have a headache. And I can just point to this and they can read it because it's written in Spanish.
Hmm.
And then they can say, yeah, I have that. And I go, okay, cool. Now I know you're having a stroke, which kind of helps me with that as well. So we've published this in two different places at ASAP. It was an abstract in 2021, and also in Stroke and Vascular Neurology in 2021 as well. So we've got the word out nationally and internationally as well. So basically, my motto is keep tranquilo and habla Spanglish, which is what I do very poorly. And that's basically what it is. And if you have any questions, if you scan the QR code, you'll have an access to the AHORA PowerPoint and the AHORA information that Remley did. And obviously that's my email if you have any questions. And Preguntas means any questions in general.
That's awesome, man. Are you guys collecting any data on this right now?
We are, and where we're looking at how many people are being helped with this. And once we get that number, we can actually say, hey, it's helped X amount of people, or people who would be missed are now being recognized for stroke, which is really what we're trying to just help our community.
Yeah, it's interesting because, this is for a Hispanic, Spanish speaking individuals, but, you think about all the others that are out there that maybe need their own scale so that way they can understand this in their, in the tongue that they speak in and understand exactly what you're asking. Because some of these questions probably don't translate over perfect when you ask them in English. And so, now it's got me thinking, Chinese and, different descents and how they speak, if they need their own stroke scale. Have you guys talked about that at all?
Well, obviously, in our population, in our country, Spanish is a number one, but
Yeah.
obviously, if you're in a community where you have, maybe they're all Chinese speaking, or if they are Hindi speaking, or whatever they're from, it would be great to be proactive as a community engagement to understand this. And the trouble with Spanish is too that each dialect is very different. So words can mean different things from
Hmm.
Venezuela to Guatemala to Brazil. So it can all be, to us, it would seem, the uneducated mind saying, "Oh yeah, that all sounds the same," but it's very different. The accents, the intuition, the meaning is different in different Hispanic populations. Even Spain, it may be different. Portugal would be different. So this is basically more of a generic tool, and obviously people are free to use it to whatever benefit they can get.
And I'm guessing all of the hospitals that you guys go to are on board with this as well, right? There's no, what is this? I've never heard of this before. They've all adopted it.
Yeah, they've all adopted it, which has been great, which makes our life a lot easier too. At Lakeland Health, they've incorporated into their electronic patient care report as well. And they have Cerner. So that works, and Baycare has Cerner as well. So I think that's been working well with that. We're working with Advent too. They have Epic, so they just switched from Cerner. So I think that should be a simple transition as well.
When I initially, heard of this and we were texting about it, I was thinking really so from the EMS provider perspective, like they walk in and they're trying to assess someone who speaks Spanish and they're having a difficult time translating that, which, obviously these graphics and these laminated cards help with, but also just general community knowledge. Everybody's got the little stroke BEFAST thing on their fridge or whatever in these nursing homes. But are you guys doing anything within the community to educate one layperson to another layperson, of the Spanish descent or Hispanic, how to identify these things?
Well, we are, and we actually worked with American Stroke, and they printed out, I think, 300 of the metallic refrigerator um, magnets.
Hmm.
So they created those. So we gave those out at community events as well. When we do stroke teaching, so we do check call compress, which is for cardiac arrest. We do stroke education as well. We add the AHORA for Spanish stroke as part of the whole thing. We would do handouts as well. So it's difficult, basically engaging with everybody possible. When we try to, we get in these communities and we do it, but also we need our hospitals help as well to be able to spread the word more, putting it in the hospital system and maybe in the waiting room. That would be also helpful as well, just to get the word out, put on billboards,
That's what I was going to say.
simple
A
things
big
like that.
billboard. I could see a big
Yeah.
billboard with it on there. Yeah. Yeah, just to get that out there more. Well, awesome. Well, Dr. Banerjee, always a pleasure. Thanks so much for coming on and sharing this. And once you guys collect some of that data and we have more, come back and we can see where it's at. But thanks for coming on.
Oh, thanks for having us. Appreciate it.